let's take a look at some of the risks involved. Although not very common, it's always good to note them. So here they are in a graphic for you, and the first one would be infection, bleeding, increased back pain, rare, nerve damage, cement leaking out of position. Not very common, these complications, doctor?
That's a great question. I think it is important to note that there are risks and benefits with every procedure. In this particular one, I think that the risks are very low, but those would include, and this is what I tell my patients, bleeding, and that would involve bleeding outside of the spine or inside of the spine. Whenever you stick a needle in through somebody's muscle or into their bone, you can cause bleeding. Number two would be infection. We use universally sterile technique to prevent that. We give antibiotics prior to incision to prevent that. And then the last and most serious would be cement leakage causing neurologic damage. And we discussed that a little bit earlier regarding if the cement were to leak out of the vertebral body and into the spinal canal and put pressure on the nerves or on the spinal cord. That is exceedingly rare, particularly if you're conscientious about using the x-rays, making sure that the cement is going exactly where you want it to go. And the last would be leakage of cement into the blood vessels, which can go up to the heart or to the lungs. Again, exceedingly rare. I've never seen these complications personally, except when somebody's had the procedure done elsewhere, unfortunately, and then they present to our emergency department, and we take the best care of them that we can.
But here, definitely the benefits outweigh the risks.
I believe so.
Yes.
I believe so.
So again, you said a 15-minute procedure with the kyphoplasty. Patients go home that same day, fantastic, and patients can get back to everyday activities pretty soon?
Yeah, I tell people really there's no limitations in terms of what they can do that I wouldn't have told them prior to the fracture anyway. And so if a 70-year-old woman comes in with compression fracture, I tell them, you know, if we've treated with the kyphoplasty, you can do what you were able to do before, but be careful because you are prone to having another compression fracture at a different level. Of course, we can take care of that, but we would obviously prefer that she doesn't have to have it in the first place.